Hi, good morning. Thank you for attending our 2021 health insurance webinar. Hopefully you will find it very informative, and we will answer most of your questions during the webinar. But like she had said, if you could hold any questions to the end, because hopefully most of them will be addressed as we go through the presentation. Okay, so what we're going to cover today is when you're looking around for the different health insurance plans for you, your family, your dental office, really what you need to be looking at so that you can actually be comparing apples to apples when you're seeing the different benefits and coverages that you can get. And why choose GDA? Why use us for not only your health insurance, but all the other different lines of coverage that we offer. We will also touch base just briefly on health savings accounts, which one of our plans does qualify for. We will actually look at our 2021 group health plans that we have and the monthly rates and the different benefits. And then lastly, we will go over how to enroll in our health insurance for you and your employees. And just so you know, regarding the 2021 healthcare exchange, I know you've probably been hearing a lot in the news about the Affordable Care Act and people kind of, some politicians trying to repeal that and having pre-existing conditions covered. So, that may affect the healthcare exchange greatly if they end up doing that. So just so you know, for 2021, the Georgia is going to have six health insurance carriers for 2021. Alliant, Ambetter, Blue Cross Blue Shield of Georgia, and Kaiser. They're the four that have been in the healthcare exchange for quite a bit. And then beginning in 2020, and they will also be offering coverage for 2021, you have Oscar Health and also CareSource. Just so you know, on the healthcare exchange, if anyone is enrolling on that, the carrier that you would be allowed to enroll through is based on your county of residence. So you're not going to have your choice out of these six as to who you use for your coverage. If you enroll through the healthcare exchange, when you log in, it will bring up who the carriers are going to be for the different plans. And again, it will be based on your county of residence as to who your providers or who the carrier will be. Okay, and just a little bit touch on what is the difference between individual and group health plans. Well, the biggest difference between an individual and group health plan is that the group health plan is something that you can offer to your employees. And typically when you're part of a group health plan, you have more negotiating power with that. Your group is larger. You can leverage lower rates. You can avoid health screenings as opposed like when enrolling in an individual plan, you may have to, they can't right now, they still can, right now they cannot exclude pre-existing conditions, but they could ask you health questions when you go to enroll in an individual plan, and they could rate you. Your monthly rates could be determined by that also. Plus, with the group health insurance plan, your rates are guaranteed for a year. There will be no surprise cancellations at any point during the year, and there will not be a premium increase during the year also. Okay, so when you're out there looking at different plans for you and your family, what do you want to look at so that you are comparing apples to apples? Two of the main things you're going to want to look at are what are the deductibles on the plan and what are the out-of-pocket maximums. Those are two of the most important things in determining premiums on health insurance plans. The other thing you're going to want to look at is what is the co-insurance. Generally, on most plans that you're going to find, it's either going to be 70% or 80%. Primary care and specialist visit copays, how much are those? And the other thing you're going to want to look at, a lot of plans nowadays are limiting the number of doctor visits you have with a copay. Generally, they're limited to 3 or 4. And then once you go past that 3 or 4 doctor visit copay, then you have to meet your deductible and go into a co-insurance situation. So you do want to look when you're looking at plans to see if you are limited on the number of doctor visit copays. Ours are not. There is no limit. If you go to see your primary care doctor or you go to see a specialist, and it's coded as a doctor visit, you are just going to have whatever the appropriate copay is, except on the high deductible health plan, which I'll cover a little bit as we go further along. The other thing is if your plan is an open access plan, which means do you need a referral from your primary care doctor to go see a specialist? If you want to see a dermatologist or cardiologist or whoever the specialist is, so you first need to go to your primary care doctor to get that referral for it to be covered by the insurance company. Ours do not. Ours are open access plans, meaning if you know you want to go see a dermatologist, look one up, find one in network, call up, make the appointment, and that's all you need to do. The other thing on looking at plans is if you have out-of-network coverage. On PPO plans and POS plans, POS meaning point of service, you do have out-of-network coverage. On HMO plans, you do not have out-of-network coverage. So you want to be sure and find that out before enrolling in a plan. And then the next two is the provider network and the drug formulary. You really don't want to enroll in any type of health insurance where your doctors aren't going to be covered, or any type of maintenance drugs you're on are not going to be covered by your insurance. Now, generally these two, you will have to ask the insurance company for links or printouts or where you can go to look it up, because they generally do not readily provide those. You will have to ask for them. Our provider network link and also our drug formulary link is on our website. So there's no user ID or password required for our website. So you can go over and look that up anytime you want to. And also your employees, if you offer it to your employees, they are able to go over and look that up for themselves also. Okay, so when going with GDA, why choose us? Well, we partner with best-in-class insurance carriers on all of our insurance lines. Not only do we provide health insurance, we also do business insurance, which includes malpractice. We do malpractice insurance for the dentist and the hygienist. We also have business owner policy insurance, workers' comp. We also do personal lines for home, auto, boats, recreational vehicles, and even pet insurance. So we only use best-in-class insurance carriers on all those lines. We also leverage our group power. We are considered a large group. We have over 1,100 primary insureds on our coverage. So we are definitely considered a large group, and we can leverage our power with that. You also have an attentive staff working just for you. When you call in, you will not have to be on hold 2 or 3 hours like you will with some insurance carriers to get your questions answered. And again, we work for our membership. The membership, the GDA dentists are our bosses. So we work for you. And lastly, and maybe most importantly, the dentists actually make up our board of directors. So the dentists know what they're looking for, value and coverage, and they have the dentist's best interest at heart. Plus, as members of the GDA, you own the Gaddis Insurance Services, so the Georgia Dental Insurance Services. So you own it. So absolutely, why wouldn't you use it? So regarding the health insurance, why choose GDA? Well, we offer great plans at very competitive rates. We always shop around during our renewal period every year. We always send out requests for quotes during renewal to the other carriers so that we're sure that we're getting the best plans and the best coverage and the best rates. We also definitely leverage the negotiating power of a group as opposed to on an individual plan. If you come back during your renewal period with a 30% increase, the insurance, if you don't like it, there's pretty much nothing you can do about it without changing your plan to something else. Well, the insurance company really doesn't care because you're one insured, but with a large group, we definitely have that negotiating power that we can use to get the best plans and the best rates. Plus, our rates are guaranteed for 1 year. It's from our plan year runs from January 1 through December 31st. You will not see a rate increase during mid-year or any time during the year. Plus, there are no surprise cancellations. The only reason we would cancel your health insurance coverage is if you're in the health insurance and for some reason you do not renew your membership, or for non-payment. Those would be the only reasons that we would ever cancel your health insurance. Plus, on ours, when you go to enroll, there is no health history questionnaire on there. It is just an enrollment form with your basic information and who's being covered. So there are no health history questions that you're going to be rated on. There is no age banding. Again, it's group health insurance, so it doesn't matter the age. The rates are the same. They're averaged across our entire, all tiers of our coverage. The rates are the same for everyone, regardless of whether you're the dentist or the hygienist or the assistant, or regardless of your age or gender, where you live, those rates are the same. Everyone shares in that because we are a group. Also, there broad network coverage. There is no narrow networks in our plan. It's once you go outside of the state of Georgia, it actually becomes Anthem's PPO network. So you do have coverage outside the state. And the thing, kind of going back to the healthcare exchange, the thing to know about those, the majority of those plans through the healthcare exchange are going to be narrow networks. And in a narrow network where you find some of your specialists, like generally in your more, even in your more rural areas, like for cardiologists or neurologists or providers like that, to actually find a provider that is in network, you may have to travel a couple of hours. The other providers that in narrow networks that are not going to be in there, and it really doesn't matter where you travel on those, but it's going to be your anesthesiologist and your radiologist and your labs. So in narrow networks, the majority of those providers are not in there. I think 99% of the plans in the healthcare exchange are narrow networks. Also in the healthcare exchange, probably, I don't know, 80%, maybe even 85% of those plans are going to be HMO plans also, where you get no out-of-network coverage on those. Again, our plan is an open access plan. You do not need a referral to go see a specialist. We also offer optional vision coverage. You do have to be enrolled in the health insurance in order to enroll in the vision insurance. And also automatically included with our health insurance is $10,000 of term life insurance included on the primary insured. It does not cover any dependents that may be covered on there, but it is on the $10,000 of term life insurance on the primary insured. That is automatically included in there. You can also offer it. The dentist can offer it for their employees. You're not required to, but it's a great recruiting tool for you. Even if you don't subsidize the premiums for the employees, it does give them an option outside of the healthcare exchange for coverage. So we have found out that it is a great recruiting tool for that. Plus, there is no minimum number of plan enrollees. The dentist can enroll without offering it to the employees. The dentist can offer it to the employees without him or her themselves enrolling in it. And there is no minimum number. If you have one employee that wants to enroll in the health insurance, that's totally fine. We can even bill the employee directly to where you're not even involved in the billing process. So there's no administrative work on your part in order for us to do that. So it's kind of like no cost, no administrative work. Why wouldn't you open it up to your employees for that? Now, in order for them to enroll, you do have to open it up to them. We can't, individual employees can't call us wanting to enroll without having the approval of their dentist first. And again, you have your dedicated customer service team. We work for you. We're going to do everything in our power to make you happy and answer any questions that you may have without putting you on hold for, 30 minutes to an hour. So just briefly, one of our plans, which I will cover here very shortly, does qualify for a health savings account. Now, the thing to know about health savings accounts, you do have to be enrolled in a qualifying high deductible health plan in order to open up a savings account. You will be able to set up your account at any institution of your choice. We do not control that. It's totally up to you. Say like you do enroll in the high deductible health plan. It just means that you're eligible for the health savings account. You are not required to open up the health savings account, nor do you have to deposit a minimum in there. If you wanted to put $50 in there or $10 in there for the year, that's totally up to you. The only thing is you cannot contribute more than what the IRS maximum is per year. It is pre-tax savings. It is a line item on the tax return, whatever the amount is up to the IRS maximum that you've deposited into that health savings account. You can do it as a line item deduction off of your tax return. You can contribute into the health savings account up to age 65 as long as you're enrolled in a qualifying plan. Withdrawals before age 65 must be made for qualified health expenses. You get to age 65, though, you can make withdrawals out of that account for any reason whatsoever. They do not have to be health related anymore. And the thing to know about the money in a health savings account, you never lose it. Funds automatically roll over from one year to the next year. So that money, if you're never using it, it will just build up from one year to the next year. Say you switch, say you enroll in a high deductible health plan for whatever reason, you want to go back to a traditional health plan for the next year, you can still use the money in that account. Since you would not be enrolled in a qualifying plan anymore, you would just not be eligible to contribute any money into the health savings account. But like I said, you can still use the funds in there even if you're not enrolled in a high deductible qualifying plan. For 2021, the IRS contribution limits for an individual is $3,600, and for a family, it's $7,200. The catch-up contribution for 2021, if you're age 55 or older by the end of 2021, you can contribute an additional $1,000. Okay, now for our plans, we have three. They're all point of service plans, meaning POS plans, meaning you have in-network and out-of-network coverage. When you look on your screen, you will see that we have the in-network and out-of-network benefits listed right there. Not only do we have them listed here, you can also go over to our website, which is gdaplus.com/health. We have a PDF of our benefit guide listed right there, and the plans are listed on pages 6, 7, and 8. But right here, you see our POS 500 plan. It has a very low deductible of $500, which these plans pretty much you can't find anymore with this low of a deductible. So that we call this kind of our Cadillac plan. So it has a $500 deductible with a $6,000 out-of-pocket maximum. The co-insurance is 80%, meaning for any services where you have to meet your deductible, once that's met, the additional covered charges after that, you would pay at 20%. Anthem would cover 80%. Primary care doctor visits are $30. A specialist is $50. And again, you do not need that referral to go see the specialist. Preventive care on all three of our plans are covered at 100%. The thing to know about this is your provider, when they send the claim in to Anthem, they have to code it as preventive. And if they do that, like for your annual checkup, flu shots, anything like that, as long as it's coded as preventive, it's going to be covered at 100% with no copay, no deductible, no co-insurance. On the prescriptions on our 500 plan, there is no separate deductible. You immediately go into a copay situation. For a tier 1 drug, $15. Excuse me. For a tier 2 drug, it's $40, and for a tier 3 drug, it's $65 copay. On the tier 4 drug, it's a $25 co-insurance up to a maximum of $350. Oh, excuse me. The thing to know, there is a mail order option on here. If you do a tier 1, I am so sorry, I'm getting choked here. on a tier 1 and tier 2 drug, there is a discount. If you do mail order, you can get a 90-day supply of a tier 1 drug for a 1-month copay. So it would cost you $15 for a 90-day supply for tier 1. For tier 2, it would be a 2-month copay for a 90-day supply. So that would cost you $80. There is no discount to do mail order for tier 3 and tier 4 drugs. If you're wanting to look and see what tier your maintenance drugs would be covered at, we do have that link posted on our website. Again, that's gdaplus.com/health, and it has the prescription formulary. You will just click on which plan you're thinking about enrolling in, and then click on the formulary, and you can search by drug name right there. The rates you see we have listed down at the bottom, those are our monthly rates. You can see with without vision and with vision rates. Our next plan is our POS 2500 plan. Again, point of service plan with a $2,500 deductible, maximum out of pocket of $7,900. Co-insurance on this is 70%, meaning once for any services where you have to meet your deductible. Once that's met, the charges above that would be paid by you at 30%, and by Anthem would pay 70%. For a primary care visit, it's $35. For a specialist visit, it is a $60 copay. And again, preventive care is covered at 100%. Now on the prescriptions on this plan, there is a separate deductible on tier 2, 3, and 4 drugs. You have to meet that $250 deductible on those. For a tier 1 drug on this plan, you do not have to meet the deductible. It is just a $15 copay. And again, if you do the mail order, you do get the discount for tier 1 and tier 2 drugs. But again, even if you do mail order on the tier 2 drug, you would have to meet that $250 deductible. You can see again, our monthly rates are listed at the bottom, without vision and with vision. And again, this is posted on our website in our benefit guide. And then our last plan is the one that qualifies for the health savings account. It is our high deductible health plan. Now, the thing to know about a high deductible health plan that qualifies for an HSA, you are going to have to meet your deductible before Anthem pays any benefits. The only exception to that is on preventive care. That is covered at 100% with no deductible, no co-insurance, no co-pays. But other than preventive care, you will have to meet your deductible before Anthem pays any benefits. So as long as you go to an in-network provider, say for a sick visit to your primary care doctor, you're going to be responsible for the full discounted amounts. Now, once you reach your $5,000 deductible, you go into a copay situation. If you go see your doctor, then it would become a $35 deductible. $35 copay for primary care and $60 for a specialist. Once you meet your deductible and your additional out-of-pocket expenses total $1,900 to bring you up to the annual out-of-pocket maximum of $6,900, then everything after that is covered at 100% on covered expenses. You wouldn't have to pay anything else out of your pocket on that, including the prescriptions. Now, the thing to know about this, on the prescriptions, you do have to meet your $5,000 deductible before you go into a copay situation on the prescriptions. And again, once your additional out-of-pocket totals that the 1,900 to reach your maximum out-of-pocket, and then things would be covered, and covered expenses would be covered at 100%. But I just can't stress enough, I want people to be sure and know they do have to meet that deductible, except on preventive care, before Anthem pays any benefits on this plan. And again, our monthly rates are listed at the bottom. You can see without vision and with vision. And again, on all 3 of our plans, you do have to be enrolled in the health insurance in order to enroll in the vision coverage. So kind of closing down here, some of the frequently asked questions that we get: are any of our plans HSA compatible? And as we just discussed, yes, our high deductible health plan is the only plan that we have that does qualify for a health savings account. How can I check to see if my provider is in network? You can go to our website, which is the gdaplus.com/health, or you can actually go to the anthem.com website and search as a guest there. You do not at this point have to set up a user ID or password for that. You can search as a guest. The one thing to note, if you are going to search to see if your providers are in network, which I suggest you do before enrolling, you want to be sure they're in network provider, is that it's going to ask you for the state. We do have out-of-state coverage, like I stated before. It does become their PPO network. But when it asks you for the state, when you're searching your provider, you're going to put Georgia, regardless of where the provider is located, even if you're going to the Cleveland Clinic or the Mayo Clinic. The state they're looking for is the state in which you're enrolling in the health insurance, not necessarily the state where the provider is located. So you would put Georgia there. Also, it asks how you're getting your coverage. You would choose the employer-sponsored plan. And then it asks you for the network. And if the network, and we have this listed on our website, when you click on the Find a Provider link, the network is going to be the Blue Open Access POS Select Network is the one that you're going to look in. Does a dentist need to be a GDA member? Yes, they do have to be a GDA member. And the reason being, this is group health insurance. In the group is the GDA membership. Can the dental practice employees enroll even if the dentist is not enrolled? Yes, they can, but the dentist has to open up the enrollment process to them. We can't have the dental employees cannot call us to enroll in the insurance without first going through their dentist and the dentist open it up to them. There is no minimum number of staff that has to enroll. If you open it up to your employees and you just have one that wants to enroll, that is totally fine. Must a dentist subsidize the premiums if the employees enroll? No, they do not have to, as long as you have less than 50 employees. You can open it up to the employees and require them to pay for the full premium themselves. Now, the thing to know, if you do open it up to your employees, and if you do subsidize it, you have to be consistent across the board in the way you do it. You can't offer it to one full-time employee without offering it to another. You can't subsidize one employee's premium without subsidizing the other. The reason being, if you do that, you open yourself up to a discrimination claim with the Department of Labor. And that can get very, very expensive. So if you do offer it to your employees, or if you do subsidize the premiums, you have to be consistent across the board in the way you do that. I cannot stress that enough. And lastly, how is the billing handled? Well, generally, unless we're told otherwise, all the employees within an office, including the dentist, are included on one statement. As long as you let us know during the enrollment process when we're setting up the billing accounts, that the employees should be billed directly because they're going to be paying their own premium. We can definitely do that. That is not a problem at all, but we do need to know when we're setting up the billing account that the employees should receive the bill directly to them. And then for those that are currently insured with us, you're already enrolled in the health insurance. If you are not making any changes for 2021, you want to keep the exact same plan. You want to, if you have the vision coverage or don't have the vision coverage, you're not wanting to make changes. The people covered under your plan are exactly the same. You're not wanting to add anyone or terminate anyone, then you do not need to do anything. Your current coverage will continue for 2021. Now, if you are wanting to make any changes whatsoever, adding the vision, dropping the vision, adding dependent, dropping dependent, you will need to complete the enrollment form. We have mailed at the first of this week our open enrollment packet. So if you're currently already on our health insurance, you should be receiving that any day now. We will have copies of our benefit guide in there. We will have a copy of the enrollment form. We also have the enrollment form listed on our website if you would like to download it from there. Like I said, if you are already enrolled with us, you're not wanting to make any changes whatsoever, you do not need to do anything for 2021. Now, our open enrollment does end on November 20th. That date is in order for anyone who has made any changes or new enrollees so that they receive their ID cards in the mail prior to January 1. We absolutely can accept enrollment forms or changes after November 20th, but any that we receive after then, those people may not have their ID card prior to January 1. The change or the enrollment would still be effective as of January 1. You just may not have your ID card prior to then. So just to kind of go over, if you want to visit our website, we have the enrollment form there. We have our benefit guide listed there. We have links to our provider network, our prescription formularies, and that website is gdaplus.com/health. If you want to enroll with us, the enrollment form is listed right there. It is a very short form. At the top, list your name, address, how you would like to receive your billing via email, regular mail. The middle section is what plan you're choosing to enroll in, if you want the vision coverage or not. And then the third part is who's being covered. If it's just you as the applicant, or you're covering a spouse, or you're covering children. And then sign and date it. We do not need the original enrollment form back. You can either fax it, and the fax number is listed here on the screen, and it is also included on the enrollment form, or you can email it to me at christy@gadental.org. We will confirm receipt of the form, whether you do it via email or fax. So if you fax it and you do not get a confirmation from us that we received it, just give us a call, because in all likelihood, we did not get it, and we want to be sure and get those enrollment forms. So if you have any questions, you can also give us a call. I'm more than happy to help. We have some more agents that can answer your health insurance questions also. We're all happy to help and answer anything that we can. And the number here at Gaddis is 770-395-0224. Thank you again for attending today. I hope I answered most of your questions, but if not, we will open it up right now to any questions that anyone may have. If you're more comfortable asking your question individually and not here on the webinar, absolutely, I'll be more than happy to help you. Just give us a call once the webinar concludes. So again, thank you, and we're going to open it up to questions right now.
If you have any questions, you can type them in the question box or the chat box. We'll give a few minutes just for you to type any questions you may have. But if there are no questions, then we will end the webinar. So I'll give, a few moments for any questions. Okay, we have one question. For the life insurance, is there paperwork for a beneficiary? How do we name a beneficiary for that?
Yes, that's a good question. Thank you. We have a form, an informational form on our website that explains the life insurance, and the beneficiary form is also included on our website. I suggest that the office or the person keep a copy, maybe the dental office keep a copy also, and then we will have a copy. We do not need the original, but that form is also listed on our website under life insurance. We also, just so people know if they're interested in what the vision coverage is, we have a document there that goes over the vision coverage. It does cover optometrist visits. Ophthalmologists are covered under your medical insurance, but optometrists are not. So with the additional vision coverage, optometrists are included. There is in-network, out-of-network benefits on that. Some of the in-network providers for, it covers glasses and contacts. Glasses, you can get frames and lenses once every 12 months, contacts every 12 months. And some of the providers for the vision insurance, it's your larger providers. It's not the one, the one-offs, the ones that are kind of hard to find, but it's like Lens Crafters and Pearl Vision and JCPenney and Target and Sears, and some of your bigger providers there are in-network providers on the eyeglasses and also the contacts. 1-800-CONTACTS is an in-network provider on that also. But we do have that document listed on our website also that explains the benefits of the vision coverage.
Is there a separate vision card that will be issued, or is it included on the main card?
It is included on the main ID card, and for those who have vision coverage, along the left-hand side, bottom left-hand side, it will say vision on there. It will be the last thing listed. If you do not have vision coverage, I don't know if you've been on our insurance, but if you compare the cards, you can see the people who do not have that vision ID number listed on their card, but it will be included. It is not a separate card.
Any more questions? All right. Well, I want to thank everyone for joining. If you have any questions, please give Ms. Christy Biddy a call at 770-395-0224, or you can send her an email at christy@gadental.org. Thank you, everyone, and have a great day.